The cement companies in the past have been reluctant to process medical waste. Primarily, the safety and health hazards are different in nature to those that we normally face in a cement plant. And
ADB was set up about over 50 years ago to reduce poverty, and it did this through investments in infrastructure mostly. About 30 years ago, we realised that we also had to not only support the governments of the countries we worked in, but also the emerging corporates in those countries. So we supported a number of emerging Asian enterprises to come in and take part where those activities were focused on creating jobs and reducing poverty. As a response to an article written about Huaxin cement by the South China Morning Post, that was shared with me. I thought that was fantastic. My hat goes off to Jia Jun and his team for responding under very difficult circumstances. So we looked at what the World Health Organization wanted to do, UNDP, UNEP, Médecins Sans Frontières, every sense of information, and we put together a data report of decisive action in the so-called fog of war, where we don't quite know what's going on. And if you look at it, most of the countries that we have as developing members in the ADB, with the exception of countries in the Pacific, all of them have cement kilns. Afghanistan even has a cement kiln. Pakistan has a number of them. Those facilities can help us deal with the surge in medical waste and getting the reverse supply chains to secure waste so it doesn't end up with the informal sector and getting sorted in places where people live in dreadful conditions, and we explore the opportunities to work with cement factories in our developing member countries.
Prepare the emergency coprocessing plans, and then we report these plans to the government and reach consensus with the government. The second is we communicate with the plans to evaluate the situation and prepare for the coprocessing. The second is the staff prepare and the staff training. The third is we check the facilities with the government experts together to ensure the facilities can co-process the medical waste. And we got the support from the government to ensure the cement plant can running continuously, because during this time the city is locked down. So we need the support from the government, include the logistic and the other permits for the vehicles and for the staff for travel. The third is the vehicles, because during this period, the vehicles for the medical waste transport is not enough. So Huaxin Eco supply 5 big vehicle for transport the medical waste preparations. The first is the cement plant, the government requirements and the co-processing facilities, traffic conditions, and the personal qualifications. The cement kiln that have sufficient co-processing experience are recommended. We should train the staffs, the laws, the rules, and the regulations related to the medical waste, because on the site they should check according to the management system to these laws. If they find some bags is not okay, they should refuse the waste. Then the hazardous waste in the past 10 years, so we use this kind of equipment for POPs in the past, and this time we also use this for the medical waste. This feeding inlet shall be equipped with airtight device to avoid if the king stop, then we should protect the staff. Because in our case, it's a very emergency case, and the city locked down. So the time for equipment selection or design is not possible, and we can't purchase the equipment. There is no logistic, and the third is the waste and the package are in varieties of categories. It's hard to find appropriate general equipment.
Were you treating in the kiln? Was it masks and gloves and protective suits, or did it also include other items? And secondly, and related to that, those yellow plastic boxes that we saw, were those disposed of or were those reused?
For the kind of medical waste in Yichang plant, according to the requirements, we only treat with the mask, gloves, and protective suit. But for Wuxue and Yangxin plant, we also treat with the waste from the mobile camping hospital.
Dealing with the waste, I think it's part of securing a license to operate, is demonstrating that the cement industry can make a positive contribution to society. And of course, the longer term advantage is it potentially sets you up, if you're getting into this, then it sets you up for disposing of medical waste or hazardous waste longer term. So it may be that it leads to longer term benefits, but
ADB's job is about creating community resilience. It's one of the fundamental things we have to do. So any assistance we can give in terms of running concessional finance to companies to build these activities, to supporting them with training, to supporting them with, as I said, conditional finance for the material upgrades and for buying new trucks and for buying process upgrades, that's interesting for us. We're interested to look at it.